Hello, doctor colleagues. My name is Dr. Vikram Jaggi, and I'm the medical director at the Asthma, Chest and Allergy Centers in Delhi and Gurgaon. Today, we are going to be discussing about how inhalational therapy is the best for airway diseases. Before that, let's just discuss very briefly why is asthma, among so many other chronic diseases, so poorly managed in the real world situation. Many times the doctor will fail to make a diagnosis of asthma. But more often than that, the doctor has made a correct diagnosis, at least in his mind, but is afraid to write asthma on the prescription or tell to the patient that this is asthma and you have asthma. He will use softer words like allergy, allergic bronchitis, congestion, eosinophilia, every possible thing, but not using the word asthma, fearing that the asthma word will drive the patient away to seek opinion of another doctor. This is counterproductive. Okay, even if the diagnosis of asthma is established and said, many times the doctor will prescribe syrups and tablets. If it is an inhaler, many times it's only salbutamol or quick relief bronchodilators. If it is a inhaled corticosteroid or a combination of bronchodilators and inhaled corticosteroids, it will not be told to the patient that this must be continued because this is a preventative. Many times the doctor is very unsure how to coach the patient as to how to take inhalers properly. The patient doesn't understand. The patient takes the inhaler in a very poor way. The medicine doesn't go inside. As a result of that, the patient doesn't get the desired good effect. And thus the patient loses faith in that doctor, in the whole medical system actually, and then is driven towards trying alternatives, etc. etc. So what will it take for asthma to be well managed? Not too much really. A clear communication in an empathetic way that, look, you seem to be having some allergic problem in the lungs, which is looks like asthma. This is asthma. Allergic bronchitis and asthma are not two different things. Inhaled medication reaching there properly is the way to control the inflammation, which is all the time there, irrespective of symptoms. They should be continued. Inhalers should be taught properly, and just take the patient along in that journey from having so much trouble with asthma to making the patient realize that asthma can be very easily controlled in a vast majority of asthma patients. I'm making two statements here, which on the face of it seem to be almost silly or absurd. But let's just pause and look at them. Drugs work where they reach. How true is that? We don't think about this when we are giving syrups and tablets. We don't have to. The medicine will reach eventually. But with inhaled medication, we have to ensure that the medicine reaches the larger air tubes, the middle air tubes, the smaller air tubes, and that is not an easy task. It's difficult, but it can be done. And drugs can only help those patients who take them. So asthmatics typically stop their medication the moment they feel slightly better. With that little brief background, let's dive into the subject of this short talk today. Inhalational therapy and its advantages. Advantages are very clear-cut. The problem in asthma and COPD is in the inner lining of the air tubes and the muscles. So there is a very easy way of sending the medicine directly over there. This becomes the quickest method. This becomes the safest method. This works at the least possible dose. So ideally speaking, all asthma treatment should be through the inhaled route. It's effective, it's safe, it's very fast acting. In a situation where there is a burn on the skin or an injury on the skin, what do? Do we prefer giving capsules or do we try to manage with ointments? If an eye is inflamed, do we not use eye drops and everybody likes that? Then what is the problem with taking inhaled medication for asthma and COPD? This we have just discussed, that the drug reaches directly in the inhalational method, and through tablets and syrups, it takes a very long time. Now the question sometimes patients pose to the doctor is, aren't these addictive? Is having too much of tea addictive? Yes, maybe. Are cigarettes addictive? Yes, definitely. Are spectacles, I'm wearing glasses to see, are they addictive? Is it an addiction? Have I become addicted to them? No. I have a problem in my eyes, I am myopic. It is a necessity. It is fulfilling a deficiency over there. Similarly is the case with inhalers, just like is the case with brushing your teeth. Is brushing your teeth an addictive thing? That once you start doing, you'll have to do it? No, it's a requirement. So if this kind of an explanation is given to the patients, they generally speaking begin to understand the concept. Inhalational therapy, although very good, but can be a double-edged sword. Tablets will work, but they will come at a cost of side effects. Inhalations will work better at no side effects, but if the inhaler is being not used properly, it is possible to get no effect, zero effect. So one has to be a little careful. Here I will just give you a short example, a situation which we faced recently. A girl was brought to our clinic recently who had asthma for a very long time, just being treated with syrups and tablets and reaching nowhere really. Somebody in the neighborhood said, why don't you take this girl to All India Institute of Medical Sciences? And the mother took her there. The professor saw that this is all rubbish. You can't treat asthma with tablets and syrup. Here is the proper inhaler for you. The girl was sent away. The mother was hopeful. Started the inhaler. The child became even worse. Why did that happen? She came to us in that situation. Because nobody has got the time to explain to a small girl how the inhaler is to be used. A little coaching, a little bit nebulization, drug starts reaching, and then things are smooth. So, inhalers when used badly can be even worse or less effective than syrups and tablets. Be mindful of that. Thank you very much.